Hey, my name is Javon Crowder. I'm doing my advocacy and policy analysis on Child Abuse Protection and Treatment Act and disabled children. Bam. Child abuse and neglect is a huge problem in the United States. The Child Abuse and Treatment Act defines child abuse and neglect as any act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse, or exploitation, or an act or failure to act which presents a pending risk of serious harm. There are three different type of neglect. Of abuse is neglect, which is like when you don't give enough food, shelter, basic supervision. There's physical abuse, striking, kicking, beating, biting. That's what that is. Or sexual abuse, which is the persuasion or forcing of a child to engage in sexual acts or imitation of such acts. Bam. Almost 3 million cases of child abuse and neglect involving almost 5.5 million children are reported each year. The majority of cases reported to Child Protective Services involve neglect, followed by physical and sexual abuse. A brief history. The Child Abuse Prevention and Treatment Act was originally passed on January 31st, 1974. CAPTA created a federal definition of child abuse and neglect. In 2015, the federal definition of child abuse and neglect and sexual abuse was expanded to include a child who is identified as a victim of sex trafficking. Disabled children are more likely to get abused than children who are not disabled. The National Center on Child Abuse did a research in 1993, and the research found that children with disabilities are abused at 1.7 times the rate of other children. Some of the risk factors for children with disabilities: the child's age, health, physical, mental, and emotional and social development may increase susceptibility to abuse and neglect. Given their size, early development status, and need for constant care, infants and disabled children are more vulnerable to child abuse. Children with special needs have a higher chance of being abused because they have a disability. Children with disabilities may be viewed as less valuable than other children. Their reports may not be considered dependable, and discipline may be more penalized and increased by a lack of respect. Other factors leading to abuse among children with disabilities are the same as those found in the general population, such as single parents, teen parents, and various levels of stress. Families with children with disabilities can experience additional stressors, including the feeling of being unprepared to care for a disabled child, including acceptance of that child as being different, having insufficient funds or time as the child begins to need additional medical and educational activities, and a lack of support from social services and networks to help with the difficult situations that come with providing care for a special needs child. Furthermore, cases with special needs children are often overlooked by protective services. Protective services do not feel as confident in cases with children with special needs, so they try to avoid these cases. Community resources. The Best Evidence Encyclopedia is a free website created by Johns Hopkins University School of Education Center for Data-Driven Reform and Education. So under funding from the Institute of Education Sciences, U.S. Department of Education, it is intended to give educators and researchers fair and useful information about the strength of the evidence supporting a variety of programs available for students in grades K through 12. One of the areas reviewed reported on the BEE is struggling readers. The BEE identifies 8 programs as having strong evidence of effectiveness: Success for All, Direct Instruction, Corrective Reading, Peer-Assisted Learning Strategies, Reading Recovery, Targeted Reading Intervention, Quick Reads, One-to-One Teacher Tutoring with Phonics Emphasis, and One-to-One Paraprofessional Volunteer Tutoring with Phonics Emphasis. Although child welfare is designed to protect children from harm, child welfare systems cannot be expected to be responsible for a child's well-being on its own. There are a number of communities who are engaged in partnerships with child welfare agencies with the focus of preventing child abuse and neglect. Teamwork is critical to promoting the well-being of children. Teachers, community and faith leaders, medical professionals, police officers, juvenile probation officers, and child welfare workers are considered matter reporters who can work together to keep children and youth safe. So doing the research for this project was very informative, and it brought to my attention that protective services for children with special needs may be something. Brought to my attention that protective services for children with special needs may be something that protective services should improve on. One of the values of social work is to promote social welfare, so making sure children with disabilities are getting adequate support from protection agencies should be a priority. Social workers should also get special training on how to properly assess cases involving special needs children. Parents should receive classes on how to attend to the special needs child, and they should also get educated on what is and what is not child abuse. Children should also get educated on places that people shouldn't touch and who to tell if someone is abusing them. Bam, and that concludes my presentation.